It's 3 in the morning, and you wake up with that familiar pounding in your temples. Your head feels like it's caught in a vice. You stumble to the bathroom, splash cold water on your face, and wonder why this keeps happening. You've been to your doctor, your blood pressure readings at the office seem fine, but something feels off. You're exhausted, irritable, and those morning headaches are becoming your unwelcome daily companion. If this sounds like you, I need you to pay very close attention to what I'm about to share, because there's a good chance that what's happening inside your body while you sleep is something most doctors never test for, and it could be silently damaging your heart, your brain, and your quality of life. I'm Dr. Sophia Reynolds, and I've spent over 25 years as a cardiologist specializing in hypertension and cardiovascular health in older adults. In my decades of practice, I've seen thousands of patients just like you, people who thought their blood pressure was under control, only to discover that hidden spikes were occurring when they least expected it, particularly during the night and early morning hours. But here's what excites me most about what I'm going to share with you today. There's a simple, natural food that research has shown can help stabilize these dangerous fluctuations, and it might already be sitting in your kitchen. This isn't about expensive supplements or complicated diets. It's about understanding how your body works and giving it exactly what it needs. Before we dive in, if you haven't subscribed to this channel yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. And if you find this information helpful, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help people just like you. Now let me tell you about Margaret. Margaret Thompson, 72, a retired school teacher from Portland, Oregon, came to see me about 8 months ago. She was frustrated, confused, and honestly a little scared. For years, her blood pressure readings at her regular checkups had been perfectly normal, hovering around 120/78. Her primary care physician had even complimented her on her excellent cardiovascular health. But Margaret knew something wasn't right. Every morning, she woke up with a splitting headache. Her husband noticed she was becoming increasingly forgetful, misplacing her reading glasses, forgetting appointments, struggling to remember the names of her former students when she bumped into them at the grocery store. She attributed it to getting older, but something in her gut told her there was more to the story. When I first met Margaret, I decided to do something her other doctors hadn't considered. I sent her home with a 24-hour ambulatory blood pressure monitor, a small device she wore on her arm that took readings every 30 minutes throughout the day and night. The results shocked her. While her daytime readings were indeed excellent, her blood pressure was spiking dramatically during the night, reaching as high as 175/105 in the early morning hours. This phenomenon, known as nocturnal hypertension, was silently putting enormous stress on her cardiovascular system while she slept. This is far more common than most people realize, and here's why it matters so much. Your blood pressure naturally dips during sleep, typically dropping by about 10 to 20%. This nocturnal dip is actually crucial for cardiovascular health. It gives your heart and blood vessels a chance to rest and recover from the demands of the day. But in many people, especially those over 60, this normal pattern becomes disrupted. Instead of dipping, blood pressure either remains flat or, in Margaret's case, actually surges during the night. This is particularly dangerous because your brain, your heart, and your kidneys are especially vulnerable during these hours. Studies have shown that nocturnal hypertension is a stronger predictor of heart attack, stroke, and cognitive decline than daytime blood pressure readings. Those morning headaches Margaret experienced? They were her body's warning signal that something was seriously wrong. The excessive pressure in her blood vessels overnight was causing her brain's blood vessels to become irritated and inflamed, resulting in that pounding pain that greeted her every morning. So what was the solution? This is where it gets really interesting, and this is the part I want you to remember. One of the most powerful tools we have for managing blood pressure, and specifically for addressing these hidden nocturnal spikes, is a food that many of my patients initially overlook because it seems too simple to be effective. I'm talking about beets. Now, before you roll your eyes or think I'm going to give you some kind of fad diet advice, let me explain the science behind why beets are so remarkably effective for blood pressure management, especially in older adults. Beets are incredibly rich in naturally occurring compounds called nitrates. Now, these are not the same as the harmful nitrates found in processed meats. These are dietary nitrates that your body converts into nitric oxide, a molecule that plays an absolutely critical role in cardiovascular health. Here's what nitric oxide does. It relaxes and dilates your blood vessels, allowing blood to flow more freely and reducing the pressure against your arterial walls. Think of it like this. Imagine trying to push water through a stiff, narrow garden hose versus a flexible, wide one. The flexible hose allows water to flow easily with minimal pressure. That's what nitric oxide does for your blood vessels. As we age, our body's natural production of nitric oxide declines significantly. By the time you reach 60, you're producing about half the nitric oxide you did in your 20s. This decline is one of the key reasons why blood pressure tends to increase with age, and why those nocturnal spikes become more common. Beets essentially help replenish what your body has lost. The dietary nitrates in beets are converted to nitric oxide through a fascinating process that begins in your mouth, where bacteria on your tongue help initiate the conversion. This is why chewing beets thoroughly or drinking beet juice can be so effective. But here's the crucial part that relates to those morning headaches and nighttime blood pressure spikes. Research has shown that the blood pressure lowering effects of beet consumption can last for up to 24 hours, with particularly strong effects during the nighttime hours. One study published in a major cardiology journal found that consuming beet juice in the evening resulted in significant reductions in nocturnal blood pressure and morning blood pressure surges. Let me tell you about Robert. Robert Chen, 68, a former civil engineer from San Diego, California, had been battling high blood pressure for over 15 years. He was on 3 different medications, and while they helped control his daytime readings, he continued to experience those dreaded morning headaches and a general sense of mental fog that made his mornings miserable. His wife, who was always researching natural health solutions, had read about beets and suggested he try adding them to his diet. Robert, an engineer by nature, was skeptical, but decided to approach it like an experiment. He started drinking 8 ounces of beet juice every evening about 2 to 3 hours before bed. He tracked his blood pressure using a home monitor, taking readings in the morning as soon as he woke up and throughout the day. Within the first week, Robert noticed something remarkable. His morning headaches, which had been occurring almost daily for years, began to diminish. By the end of the second week, they had almost completely disappeared. When he checked his morning blood pressure readings, they had dropped by an average of 15 points systolic and 8 points diastolic. I couldn't believe something as simple as beet juice could make such a difference, Robert told me when he came in for a follow-up appointment. I've spent thousands of dollars on medications over the years, and this $5 bottle of beet juice did what none of them could fully accomplish. Now, I want to be very clear here because this is important. I'm not suggesting anyone stop taking their prescribed blood pressure medications without consulting their doctor. What I am saying is that adding beets to your diet can be a powerful complementary strategy that may help address issues that medications alone sometimes don't fully resolve. If you're still watching and finding this information valuable, please take a moment to drop a comment below with a quick one to let me know you're with me. Your engagement helps more people discover this important health information. Let me explain a simple protocol that many of my patients have found effective. I call it the evening beet protocol. The key is timing. For maximum effect on nocturnal blood pressure, you want to consume your beets in the evening, ideally 2 to 3 hours before bedtime. This gives your body time to begin converting the dietary nitrates into nitric oxide, so the effects are active during your sleep. You have several options for how to consume beets. Fresh beet juice is perhaps the most potent and fast-acting option. About 8 ounces, roughly 1 cup, provides a concentrated dose of nitrates. If you don't have a juicer, many grocery stores now carry pre-made beet juice in their refrigerated sections. Cooked beets are another excellent option. About 1 to 2 medium-sized beets, roasted or boiled, provide a good dose of nitrates while also giving you beneficial fiber. The cooking process does reduce the nitrate content slightly, but beets are so rich in these compounds that cooked versions are still highly effective. Raw beets, grated into salads or sliced thin, preserve the maximum nitrate content. However, some people find raw beets difficult to digest, so if you're new to beets, starting with cooked versions might be easier on your system. Beet powder is a convenient alternative that many of my patients prefer. You can mix it into water, smoothies, or other beverages. Look for products that list the nitrate content on the label. Now let me share something important that I've learned from years of clinical experience. Consistency matters more than quantity. It's better to have a moderate amount of beets every day than to have a large amount occasionally. The blood pressure benefits build over time, and your body becomes more efficient at converting the nitrates to nitric oxide with regular exposure. Let me tell you about Dorothy. Dorothy Williams, 75, a retired nurse from Atlanta, Georgia, came to me with a particularly challenging case. She had what we call resistant hypertension, blood pressure that remained elevated despite being on 4 different medications at maximum doses. She was also experiencing severe morning headaches, often so intense that she would spend the first 2 hours of every day lying in bed with the curtains drawn. Dorothy had been a nurse for 40 years before retiring, and she approached her own health with a clinical mindset. She had done research, tried various supplements, adjusted her diet multiple times, but nothing seemed to make a significant difference. When I suggested the evening beet protocol, she was initially skeptical. "Dr. Reynolds," she said, "I've been a nurse my whole career. If beets could lower blood pressure significantly, don't you think I would have heard about it?" I explained the research to her, the mechanisms of action, the studies showing benefits specifically for nocturnal hypertension. As a former healthcare professional, she appreciated the scientific explanation and agreed to give it a try. Dorothy decided to incorporate beets into her routine in multiple ways. She started drinking a small glass of beet juice in the evening, about 6 ounces. She also began adding roasted beets to her dinner salad several times a week. And on days when she didn't have fresh beets available, she mixed a tablespoon of beet powder into her evening herbal tea. The changes she experienced were remarkable. Within 3 weeks, Dorothy's morning blood pressure readings had dropped significantly. Her morning headaches, which had been a constant presence for over 5 years, were reduced to occasional mild discomfort and eventually disappeared almost entirely. But what moved me most was when Dorothy told me about how her mornings had transformed. Instead of lying in bed suffering, she was now waking up refreshed and spending her early mornings in her garden, something she had been unable to enjoy for years. She started calling her evening beet juice her morning medicine. Now I need to address something important. Some people experience a harmless but startling side effect when they first start eating beets. You might notice that your urine or stool takes on a reddish or pink color. This is completely normal and is caused by compounds called betalains, which are the pigments that give beets their deep red color. It's not blood, and it's not dangerous. However, if you're ever concerned or notice other unusual symptoms, it's always wise to consult with your healthcare provider. Let me talk about why beets are particularly effective for morning headaches specifically. Morning headaches in older adults often have a vascular component. During the night, as blood pressure spikes, the blood vessels in your brain experience excessive pressure. This causes them to become inflamed and irritated. By the time you wake up, you're experiencing the aftermath of hours of this vascular stress. The nitric oxide produced from dietary beet nitrates helps in several ways. First, it relaxes those blood vessels, reducing the pressure they experience during the night. Second, nitric oxide has anti-inflammatory properties that can help calm irritated blood vessels. Third, improved blood flow means better oxygen delivery to brain tissues. which can help prevent the oxygen deprivation that sometimes contributes to morning headaches. But here's what makes beets particularly special compared to other blood pressure interventions. The effect has a natural rhythm that aligns with your body's needs. When you consume beets in the evening, the peak blood pressure lowering effect occurs during the night and early morning hours, precisely when most people with nocturnal hypertension need it most. It's as if beets were designed to address this specific problem. Let me tell you about Harold. Harold Martinez, 81, a retired architect from Phoenix, Arizona, was one of the most health-conscious patients I've ever had. He exercised daily, maintained a healthy weight, limited his salt intake, and had been taking blood pressure medication faithfully for over 2 decades. Despite all this, he continued to struggle with morning headaches and what he called brain fog that didn't clear until nearly noon each day. Harold's case was complicated by the fact that his doctor was reluctant to increase his blood pressure medications further due to concerns about side effects in an older patient. At 81, aggressive blood pressure treatment can sometimes cause dizziness, falls, and other complications that can be just as dangerous as the high blood pressure itself. When I introduced Harold to the concept of using beets as a complementary approach, he immediately saw the logic. "It makes sense," he said. "Work with my body instead of against it." Harold took a particularly systematic approach. He purchased a high-quality beet powder and began taking it every evening, mixed with a small amount of apple juice to improve the taste. He was meticulous about timing, always taking it between 7 and 8 in the evening, about 3 hours before his usual bedtime. Harold kept detailed records of his blood pressure, his headache frequency and intensity, and his subjective assessment of his morning mental clarity. After 6 weeks, the data was clear. His morning systolic blood pressure had dropped by an average of 18 points. His headache frequency went from nearly daily to about twice a week, and those remaining headaches were much milder. Most impressively, his brain fog duration had decreased from lasting until noon to clearing by about 9 in the morning. "For the first time in years, I feel like myself again in the mornings," Harold told me. "I'm working on design projects with my grandson, something I couldn't do before because my head just wasn't clear enough." Now, I want to share something that might surprise you about this whole topic. The morning headache and blood pressure connection isn't just about immediate comfort. It's about long-term brain health. Research has shown that chronic nocturnal hypertension and morning blood pressure surges are associated with accelerated cognitive decline and increased risk of dementia. The brain is extremely sensitive to blood pressure fluctuations, and repeated episodes of excessive pressure can damage the tiny blood vessels that supply brain tissue with oxygen and nutrients. Every time your blood pressure spikes during the night, it's like your brain's blood vessels are being stretched beyond their comfort zone. Over time, this repeated stress can lead to small areas of damage called white matter lesions. These lesions accumulate silently and are associated with memory problems, processing speed issues, and other cognitive changes that many people incorrectly attribute to normal aging. By addressing nocturnal blood pressure with strategies like the Evening Beet Protocol, you're not just preventing morning headaches, you're potentially protecting your brain's long-term health. This is preventive medicine in the truest sense. Let me tell you about one more patient who illustrates this beautifully. Grace O'Brien, 69, a retired corporate attorney from Boston, Massachusetts, came to see me primarily because she was concerned about her family history. Both of her parents had developed dementia in their late 70s, and Grace was determined to do everything possible to protect her own cognitive health. When I evaluated Grace, her blood pressure seemed well controlled on paper. But when we did 24-hour monitoring, we discovered significant nocturnal spikes. She also reported occasional morning headaches, though she had always dismissed them as just waking up on the wrong side of the bed. I explained to Grace the connection between nocturnal blood pressure and brain health. As a former attorney, she wanted to see the evidence, which I was happy to provide. The research was compelling, and Grace decided to aggressively address her nocturnal hypertension using every tool available, including the Evening Beet Protocol. Grace became one of my most committed patients when it came to the beet regimen. She invested in a quality juicer and began making fresh beet juice every evening. She experimented with combinations, finding that beet juice mixed with a small amount of carrot juice and ginger was both palatable and effective. Over the following months, Grace's nocturnal blood pressure normalized. Her occasional morning headaches disappeared entirely. But what Grace cares about most is what we see on her annual cognitive assessments. 3 years into her beet protocol, her cognitive function remains sharp and stable, showing none of the decline that might be expected given her family history and age. "I can't know for certain that the beets are protecting my brain," Grace told me at her last visit. "But I know they're not hurting, and they've definitely improved my mornings. That's enough for me." I want to share some practical tips for incorporating beets into your routine in a sustainable way. Taste can be a barrier for some people. If you find the earthy flavor of beets challenging, here are some strategies. When making beet juice, combine it with apple, carrot, or orange juice. The sweetness helps balance the earthiness. Adding a small piece of fresh ginger can also make the flavor more appealing and provides additional anti-inflammatory benefits. For cooked beets, roasting brings out their natural sweetness. Try roasting beets with a drizzle of olive oil and a sprinkle of sea salt, then serving them with a splash of balsamic vinegar and some crumbled goat cheese. Many people who think they don't like beets discover they actually enjoy them when prepared this way. If you're using beet powder, quality matters. Look for products that are made from whole beets and have been tested for nitrate content. Some lower quality products may not provide meaningful amounts of the beneficial compounds. Storage matters too. Fresh beet juice should be consumed within 24 to 48 hours for maximum benefit. The nitrates begin to degrade over time, especially when exposed to air and light. Store any leftover juice in an airtight container in the refrigerator. Consistency, as I mentioned earlier, is key. Set a reminder on your phone for the same time each evening. Make it part of your routine, perhaps right after dinner or while watching your favorite evening show. The easier you make it to remember, the more likely you are to stick with it. Before I wrap up, I want to address a few important considerations. If you're taking blood pressure medications, particularly nitrate-based medications for heart conditions, please talk to your doctor before significantly increasing your beet intake. The combination can sometimes lower blood pressure too much, which can cause dizziness or fainting. If you have a history of kidney stones, particularly calcium oxalate stones, be aware that beets are relatively high in oxalates. While this doesn't mean you can't eat beets, you might want to discuss appropriate amounts with your healthcare provider. And of course, beets are not a replacement for blood pressure medications or regular medical care. They're a complementary strategy that can work alongside your existing treatment plan to provide additional benefits. So, what should you do now? First, if you're experiencing regular morning headaches, especially if you're over 60, consider talking to your doctor about monitoring your blood pressure during the night. A 24-hour ambulatory monitor or even a home device that takes readings while you sleep can reveal patterns that regular office visits miss. Second, consider adding beets to your evening routine. Start with a modest amount, perhaps half a cup of beet juice or one small roasted beet, and see how you respond. Pay attention to your morning headaches and overall energy levels. Third, keep a simple log for a few weeks. Note your evening beet consumption, your morning blood pressure if you're monitoring it at home, and any headaches or changes in how you feel. This data can be invaluable for discussions with your healthcare provider. Fourth, be patient. While some people notice improvements within the first week, for others it takes several weeks of consistent use before the full benefits become apparent. Your body needs time to adapt and optimize the conversion of dietary nitrates to nitric oxide. Remember, you have more power over your health than you might think. Sometimes the most effective solutions are the simplest ones, the ones that work with your body's natural processes rather than against them. A humble red vegetable that's been consumed for thousands of years might just be the key to better mornings, clearer thinking, and a healthier heart. Thank you for spending this time with me. If this information has been helpful, please consider sharing it with someone you care about who might benefit. Leave your questions and suggestions for future videos in the comments below. I truly do read every single one, and your feedback helps me help more people like you. Take care of yourselves, and I'll see you in the next video.